When it comes to the COVID vaccines, California has a statewide mandate for teachers, but not staff at daycares or preschools. A new study argues that should change. ABC 10 News anchor Derek Stahl is going in depth with the authors who say childcare workers shouldn't be an afterthought.
Look over here.
Since October, K-12 teachers in California have been required to get a COVID vaccine or undergo weekly testing. The governor says he'll remove the testing option later this year. But the state's policy does not apply to staff at preschools or daycares, which serve very young kids.
The argument in favor of vaccinating childcare professionals is certainly as strong as the argument in favor of vaccinating school teachers, if not stronger.
Dr. Kaveen Patel is an infectious disease fellow at Yale. He points out young children don't socially distance well, and kids under 5 remain ineligible for the vaccines.
We can't vaccinate the infants and children, so we got to focus on the people that we can vaccinate and make a difference in, and that's childcare professionals.
In a new paper, he and his colleagues found that California is one of 6 states with a vaccine requirement for teachers, but not childcare professionals. Only 4 states have policies covering both groups, says Yale professor Dr. Walter Gilliam.
When we have a mandate that's designed to keep teachers K through 12 safe, and we don't include childcare providers, it becomes a public safety and public health commentary on the importance of them and their work.
Not only are childcare workers surrounded by unvaccinated kids, they have other risk factors. A larger percentage of childcare professionals are racial or ethnic minorities.
Many of these minority groups, Blacks and Hispanics, they're at higher risk for both contracting COVID-19 and if they do get COVID-19, they're at higher risk for having a bad outcome from it.
Their research has found that 78% of childcare professionals are vaccinated, compared with 90% of teachers. That 12-point gap might not sound like a lot, but Dr. Patel says it's significant in the face of a highly contagious virus. Just look at measles.
In order to prevent outbreaks of measles from occurring, you need vaccination rates approaching essentially 100%. Omicron is also very contagious, so the higher the vaccination rate you have, the lower the risk of an outbreak. So every percentage point certainly makes a difference.
He says it's not clear why so many states mandated shots for teachers, but not childcare staff. It might be because of the political pressure to keep schools open, or because preschools and daycares are largely privately owned.
In terms of public policy, oftentimes young children are an afterthought, and as a result, those who care for young children are an afterthought.
You ready to count with me? 1, 2, 3, go!
California lawmakers have introduced a bill that would require preschool and daycare students to be vaccinated, but in its current form, it would not apply to childcare workers. Derek Stahl, ABC 10 News.
And even though there's no statewide mandate, some preschools and daycares have chosen to implement their own vaccine requirements.